We are studying the treatment of early COVID-19. So we are looking for people who are outpatients who have been diagnosed with what's called SARS-CoV-2, which is the name of the virus that causes COVID-19. So people who have just gotten told that they have that infection, who've been tested within the previous 96 hours. It is looking at people very early on, and we know from a number of different other kinds of infections that if antiviral treatment is going to be effective, it tends to be most effective if it's given very early on. And so even if we thought that this treatment didn't work later in infection, we are more optimistic that it might work earlier. The treatment is a treatment of two medications. One is called hydroxychloroquine. The other is called azithromycin. And there have been reports both in the test tube as well as in people that this combination may suppress the SARS-CoV-2 infection. There have been, so far, no rigorous studies of it. There have been a number of publications looking at outcomes in hospitalized patients given this treatment, but none of them have been the rigorous study design that is usually used to determine whether treatments are effective. We know that there are two other studies of hydroxychloroquine that are ongoing at the University of Washington. One is in a very similar patient population, and in fact was designed specifically in conjunction with the design of the study that we are doing, with an idea being that they were designed in conjunction to have collaborative, to have information that will complement each other. Their study was designed to be relatively fast to be done, relatively small, and to be able to answer a question quickly about whether these drugs have efficacy in terms of suppressing the SARS-CoV-2 virus. Our study is larger and is designed to answer a clinically relevant question: does this combination prevent hospitalization and death? The study that we are doing actually has been very carefully thought about by a number of people, both who are doing the study as well as committees that oversee research, as well as the Food and Drug Administration. And in fact, the dose of one of the medicines that we are giving is actually lower than it was initially planned to be, because the FDA had some concerns about potential toxicities. So the study was therefore redesigned with a lower dose, and in addition, it had already a number of safeguards that are being put into place to try and make sure that the people in the study are safe and don't have side effects. The fact that we can enroll people from around the state, they don't have to have any visits in person. They can have telephone visits, so if someone has access to a phone, they can enroll in this study if they're willing. Hopefully that will ease the burden and make it easier to find people to enroll.